And with me is the Health Minister, Edwin Poots. People are clearly concerned about what services there are going to be to replace these residential homes. What reassurance can you give to families who are watching this programme tonight that their relatives will get the care that they need?
Well, absolutely get the care that they need. I think that we're very clearly focused on what we want to do, and that's create better options for elderly people to maintain their independence and to maintain their dignity. And we believe that supported care is a much better option for frail elderly. However, there is an issue about how we handle those elderly people who are currently in residential homes, who are content in those residential homes, and we understand that it can cause a huge amount of stress to them if there's a proposal to move them.
But you heard a relative in the report from Mary Louise there. She says the care that her relative gets is fantastic. Are you saying that these homes are not fit for purpose?
No, I think that what we're looking at is a different form of care, and what the supported care will actually provide is more for people who become frail and have to perhaps move into residential care, and this is a different option for them. I think the people who are currently in residential care, those are people who we need to demonstrate that we will treat them with dignity and care and respect. And the trusts have identified that they want to close 100% of homes. Transforming Your Care said 50%. There's a consultation exercise to take place, and it's very important that we listen to the views of the public.
You approved the Transforming Your Care 50%. Do you think the trusts are going a step too far?
Well, they're going a step further.
Is it a step too far, though, in your view?
I think it is for the trusts to demonstrate that if they want to close 100% of homes, what the benefits are to the elderly people that we're providing care for. It has to be in the interests of the elderly population, not in the interests of the trust.
If the idea is to have more care for people in their own homes, already we have been told by viewers that at best sometimes that's piecemeal and that relatives and family have to take up the burden there. What are you going to do to make sure that people get the care that they need in their home for their specific needs, if that is what they wish?
Well, that is the experience that people have had, and therefore there is some negativity. And that's why in Transforming Your Care we identified 479 supported living places, which you have seen on television tonight through Mary Louise. And that is the type of care that we want to offer to people who become that little bit frailer, but who want to maintain their independence, but also have that security of 24-hour support. So someone comes in to help get people up in the morning,
but
to help
prepare food.
But
that's not provided for many people now. Families are having to take over that care because they're not getting the 24-hour care that they need at home.
Yes, but this is a new concept that we have, and
that
is part of Transforming Your Care, and the funding has been identified.
Have you the money to fund that, Minister?
That has been set aside for this. So what we'd be losing in residential care will be replaced by supported living.
Minister Edwin Poots, thank you for joining us on BBC Newsline.